Passive horizontal adduction. Passive lateral rotation from 90 degrees abduction. Compare with the normal execution to differentiate between anterior capsular adhesions and the subcoracoid bursitis. Apprehension test for anterior instability. The therapist puts the fingers of his contralateral hand anterior on the humeral head with the thumb posterior. With the other hand, he brings the arm in full rotation and simultaneously the thumb exerts an anterior pressure on the humeral head, trying to provoke the subjective feeling of subluxation. Apprehension test for posterior instability. The patient is sitting with the arm in slight abduction medial rotation. The therapist stands anterior, puts the thumb of the contralateral hand anterior and the fingers posterior. More medial rotation is built in, while the thumb exerts a posterior pressure, trying to provoke the subjective feeling of subluxation. Push against the wall with both arms. This test is related to the function of the serratus anterior muscle. Scapula adduction against resistance. We try to move one scapula in lateral direction. In the case of mononeuritis of the spinal accessory nerve, unilateral weakness can be found. Resisted forward and backward movement from 90 degrees abduction. This tests the function of the deltoid muscle. Resisted horizontal adduction. This tests the function of the pectoralis muscle. Resisted forward movement, arm kept at the side, in order to detect a rare lesion of the coracobrachialis muscle. Resisted adduction with 90 degrees elbow flexion. This has to be compared with the adduction from the normal position. It is possible to detect a rare type of biceps lesion.